welcome to the Stronger After Stroke podcast. I'm your host, Nurse Rosa Hart, and today my guest is Dr. Gregory Cooper. He is the Chief of Adult Neurology as well as the Director for our Memory Center at the Norton Neuroscience Institute. So thank you so much for taking time out of your busy day to be with us.
Well, thank you for having me. I appreciate it.
So as a memory specialist, you probably get the questions we're about to go over on a frequent basis. So what types of memory problems can occur after a stroke?
So the answer is almost anything can occur after a stroke. Now, we often think of memory, sort of broadly speaking, not just memory, but memory itself, language, attention, our ability to navigate, our ability to plan, organize. All of those things can be affected. And to some degree, it depends on the type of stroke, where the stroke was. So, for instance, there are some strokes that will cause really a problem with short-term memory. We have trouble forming new memories, so we'll be more forgetful. But there are other strokes that cause difficulty with language, where we can't quite access the words we want to say or communicate. Others that will affect our ability to navigate, others that will affect our ability to plan or organize. So again, it's really quite varied, and it really depends on the stroke itself.
So how common are memory problems after a stroke?
So unfortunately, very common. And the last estimate I saw would say about 19%. So about 1 out of every 5 people with a stroke will have some degree of memory or cognitive impairment.
So what causes those memory changes related to stroke?
Sure. So with stroke itself, to a large degree, it's all about location. Different parts of the brain do different things. So, for instance, there's one part of the brain called the hippocampus, and that's involved in forming new memories. So, if I have a stroke that damages the hippocampus, I have trouble forming new memories, learning new information. So, I'm forgetful, I repeat myself, that sort of thing. So, it really depends on damage to certain parts of the brain that have these different functions and disruption of those networks.
It can be very complicated, can't it?
It can be complicated.
Well, more than one at a time.
Yeah,
Right?
I remember early on in my career, somebody told me if you've seen one person with a stroke, you've seen one person with a stroke.
No two are alike,
No two
huh?
are alike. That's exactly right.
So can those memory problems improve over time?
So they definitely can. And again, it as you said, it's very complicated. If I have memory problems related to a stroke, even if I do nothing at all, there is often some expected natural recovery from that, maybe the most over the first 3 months, but that can continue for months or even over a year afterwards. And then there are things we can do to really maximize that recovery. So, working with a good therapy team, physical therapy, maybe more for our physical health, but occupational therapists, speech and language pathologists for those memory and cognitive concerns. And so those things can certainly accelerate or at least maximize that recovery.
Yeah, I would think when we were talking to Dr. Rundeck last year about
Yeah.
brain health, she was telling us about some research that was showing that just physically exercising and walking could improve your memory
No,
and cognition.
we are learning more about that all the time. So, in the past, we would have, of course, said having a good diet, doing things that you're supposed to, not smoking,
Which we would
getting,
still say.
which we would still say, getting exercise. Those things all help prevent stroke and help prevent cognitive problems. But we're now learning it's not just prevention. Those things can actually improve our overall brain health. So, absolutely right. If we get regular exercise, and it may be as simple as just walking. It doesn't mean that we have to train for a marathon.
Mhm.
Doing those things very definitely can improve our overall brain health and improve our memory.
That is encouraging.
It is. It is.
Are there any medications that might help as well with
There,
memory?
there are. So there are medications that were developed for Alzheimer's disease. So they weren't developed or approved for memory loss due to vascular disease or stroke. But there is evidence that they, for many people, can improve memory and thinking. So we generally refer to these as cognitive enhancers. They fall into a couple categories. One are called cholinesterase inhibitors. Donepezil, rivastigmine, and galantamine are three medicines in that class. Then there's another class by itself, memantine. Again, those were developed for other reasons, but we have real evidence that shows that they can also improve cognition in people where their memory loss is related to stroke or vascular disease more broadly.
So vascular disease is something that affects the blood vessels,
It
right?
it is, and we often think of these things really together. So, I can have changes in my blood vessels, maybe in the large blood vessels, the medium blood vessels, or the very tiny blood vessels deep into my brain. And those changes can put me at risk for stroke. So if I have a sudden blockage to one of those blood vessels, I lose blood flow to that part of the brain, and that part of the brain may be damaged and may die. That's a stroke.
Hmm.
But then it can be more of a chronic disease where it's as if I have insufficient blood flow, oxygen delivery, nutrient delivery to the brain. And that can cause a more gradually progressive decline in cognition. And in truth, we often can see some combination of those things. So when I think about treatments that can help with memory and thinking, I'm thinking about vascular disease, whether it's from a sudden stroke or whether it's from this more chronic condition.
But the medications that you listed, they're not for vascular disease, right? So how do they help the brain?
So that's a great question. So you're right. They're not improving blood flow in a sense. They're not changing how those blood vessels look. These are actually acting at the level of what's called the synapse, the connection between brain cells, and improving the communication between those brain cells. So we're improving the overall communication, the overall function of those brain cells. And in that way, they improve memory and thinking, really very broadly speaking.
Yeah, that's really interesting. I need to learn more about that. So, how can caregivers support a stroke survivor who has memory problems?
So I would argue first, be patient. If I have a stroke, there are going to be things I have difficulty doing for some time. Be patient with me. Be supportive of me. At the same time, don't do everything for me. Let me try to do things for myself, maybe even challenge me, push me to do those things myself. Also, help me maintain a routine. We do better when we have a routine. When we're taken out of that routine, that's much more taxing on us cognitively. So be supportive, but don't do everything. Push us a little bit. Help us maintain that routine.
I love how you put that in first person, and it's great how you're so invested in all your patients. I know it's important for me to have a routine,
Yeah.
and my brain works better during the school year because
we,
we have to get up at the same time every day.
we all do. We all do.
So it's not just for stroke
No.
survivors. And a stroke may totally change whatever your routine was before the stroke, and you may need to find a new normal
That's right.
and establish a new routine. So making that a priority can
That's
have
right.
an impact.
And that can even change over time. So something I can't do today, maybe I can do next month. So my routine changes, but in a positive way.
Yeah,
Yeah,
yeah. We like positive
we
changes.
do. Yes.
Yeah. So when should someone seek professional help for memory problems after a stroke?
I would argue if there's a concern, it's reasonable to be checked out. That doesn't always mean that we'll see a significant change or that it'll change treatment. And if it's immediately after the stroke, maybe we should allow some time for recovery. But I would argue if someone has a concern, it's reasonable for them to be checked out. Even more than that, though, I would say if friends or family have persistent concerns. So if I have problems with memory, I'm often not aware of that. It's going to be more apparent to those around me.
Because they can remember what you were supposed to remember?
Well, in a sense, and I know this sounds silly, but if I have a memory problem, I don't remember what I don't remember.
Exactly.
We often say in my field, and to a large degree it's true, if somebody comes into my office and they say they're worried about their memory, the odds are very high that there's not a problem. If somebody comes into my office and says, I'm doing fine, but my family over here has a problem, that's when I'm really worried about it. So I think this is a case where it's okay to really lean on and rely on our loved ones to help, tell us if there's a concern and then have that checked out.
And give that outside perspective.
Yeah, that's exactly right.
Yeah. So, can memory problems after a stroke lead to dementia?
So they can, but they don't always. So, a term that we are often using now is vascular cognitive impairment. And what that means is what it sounds like, some cognitive impairment related to vascular disease. But then that can mean a wide spectrum. So, it may be very mild, where, okay, I may have some mild changes in language or memory, but it's not to the degree that it's preventing me from doing my normal activities. That would be something we might call mild cognitive impairment. Or it may be more severe to where now there are just certain things I can't do. I need help. And that would be when we worry about a dementia. That can happen right away after a stroke. It can happen after we've had multiple strokes. It's not something that always happens. So the answer is yes, but not always.
Well, it's never always, is it?
No, it's never.
Those are the two words we're not allowed to say, right? Never and always.
That's right.
How can someone monitor their memory improvements after
Yeah.
a stroke?
So that one is hard, but there are ways to do that. I think on one hand, hopefully we can notice changes, positive changes ourselves. But the truth is, and this may sound silly as well, but we're living with ourselves every minute of the day. Sometimes it's very hard to see that change. So then our friends, our families are slightly more removed. They can often see change more effectively than we can, so we can rely on them to notice any changes. And maybe even better than that, if we're working with a therapist, a speech therapist, an occupational therapist, they can really measure those changes. And so I might work with somebody, and 3 months later, I'm frustrated. I haven't noticed any change at all. But they can actually show me how they've tested me from 1 month to 2 months to 3 months and see that positive change. So that can be a very helpful way to look at it.
Well, you mentioned that emotional component of just feeling so frustrated, especially for people who are kind of aware that something's not right and
Yeah.
they can't make it better. So, when you're noticing that about a patient or in their interactions with their family, how can you encourage them to cope with just the frustration and that emotional fatigue?
I think it can be difficult. It's easy enough to say you've got to be patient, give yourself some grace, but that's easier said than done, I think, for all of us. But it's true. This is a time that really requires persistence, hard work, and patience. Also, break it down into little victories. You're not going to have all of your recovery in 1 week, but maybe you can have small steps forward and focus on some of those positive things. And I think that perhaps can be helpful. Unfortunately, it is true that many of us aren't going to make a full recovery, and so we have to focus on what we can do, not so much on what we can't do, but what we can do, and try to spin it a little more positively. None of that is to say it's easy,
Yeah.
but I think there are things that we can do that can make our lives better and can give us a more positive outlook.
I really appreciate this holistic approach to treating a whole person and wrapping around the whole family to be part of it.
I think it's much better to look at the whole family. We should not be isolated individuals. We're so much stronger together.
So true. So, we have a previous episode with our cognitive therapist. She's a speech language pathologist, Ann Blanford,
Oh,
and
she's
she had
terrific.
prepared a tip sheet for like cognitive exercises
Yeah,
you can do at home. So, if you want to take a look at the show notes in the last episode, that can be printed out. Some people may not have access that are listening to this podcast to visit with physical, occupational, or speech therapists that are trained for neuro
yeah,
specific needs. And so you may want to check out the other episodes we have with rehab specialists, like in physical and occupational therapy as well.
that's terrific.
Thank you for taking your time today.
I really appreciate being here. Thank you.
Yeah. And if you've enjoyed this episode of the Stronger After Stroke podcast, be sure you subscribe on whatever platform you're listening on. And if you're watching on YouTube, and leave a comment if there's something you'd like to hear more about or something that was helpful for you to let us know. And I'll see you in the next episode.